to our Global Health Series. I'm with Dr. Catharine Young from the White House Office of the Cancer MOONSHOT. I'm not going to attempt to mention her long title, but I'm going to, for those of you who have not watched an interview with her before, I'm going to invite Dr. Catharine to tell us more about what she does at the Office of the Cancer MOONSHOT. Welcome, Dr. Young.
Thank you so much, Vivian. Yes, I am the Assistant Director for Cancer Moonshot Policy and International Engagement. As maybe some of your audience members already know, that the Cancer Moonshot has been traditionally domestic in focus, but over the last year and a half, we have made a very concerted effort to extend the mission of the Cancer Moonshot beyond the U.S. borders, because we certainly believe that its mission, its goals, and its objectives really apply to the global landscape of oncology as well. And so my role has been to really start to drive that strategy, build those relationships, and really work with the global communities to see change happen on a worldwide scale.
And what, if you don't mind me asking, what was that aha moment that the Office of the Cancer MOONSHOT decided, you know what, we need to expand these goals beyond the United States?
Yeah, so actually back in 2016 with the first Cancer Moonshot under then Vice President Biden, there was global activity as part of that portfolio. But this time around, we've had an entire administration to really get the work going, understanding a lot about what the needs are and what the global objectives are, and really the time and the effort with really the entire community to come together to say that this is and must be a priority, and we absolutely agree with that.
Right, and then when we talk about cancer, it has now almost become a buzzword globally. But in terms of the work of the Office of the Cancer Moonshot, what are some of the key areas you focus on with cancer? And of course, given that the cancers are so many,
right.
And are there any particular cancers that you're most concerned about?
Yeah, well, of course, we're concerned with all of them, but I think in terms of some of the work that we have had a focus on, I would say cervical cancer is one of them. The First Lady has done a tremendous amount of engagement with other First Ladies, even on the continent of Africa specifically, around cervical cancer. But I think what is helpful is that we have this unified global goal of eliminating cancer, and I think the fact that we are seeing so much movement and momentum around this goal has made our job a lot easier to really get plugged into that and to really try and catalyze that movement a lot more. So while I say that we care about all cancers, cervical cancer has really surfaced to the top for us.
And we, of course, we love the whole vision of eliminating cancer, but I recently completed my studies and my focus was cervical cancer.
Yes.
So I'm glad that you're bringing it to the forefront. But one of the things I learned was that there were the issues that biosocial issues affecting or around cervical cancer, especially in sub-Saharan Africa, were complex and almost harder to address without a very robust communication strategy, intentional communication strategy. So in terms of your approach to eliminate cervical cancer, what are the different strategies you have for the United States and for low and middle income countries, and maybe to be specific, sub-Saharan Africa?
Yeah, well, I think, when we think about the challenges of both the U.S. and low and middle income countries, certainly we both have challenges to overcome. The United States can and must do a better job, to your point about communicating around HPV vaccination, around screening, around treatment, and the same can be said around the world as well. We absolutely understand that approaches need to be modified depending on where you are in this world. The needs are different, the response will be different, the challenges will be different. And so we work really closely with countries to, understand what those needs are and how we might be able to help support in those regards.
And what are some of the partnerships you have so far created with low and middle income countries to partner with you in this goal to eliminate cancer?
Yeah, absolutely. Well, really the whole effort around sub-Saharan Africa began at the African Leaders Summit in 2022, where we announced over $300 million in commitments from both the U.S. government and from private sector commitments, which, you know, I think is a very important part of this. It is not just the U.S. government leading the way. We are bringing communities, including the private sector, including the patient communities, advocacy communities, to really solve these problems together. So that was really kind of the catalyst of our global work. We will actually be hosting a White House Africa Cancer Care Forum for the first time.
Yay.
Coming soon, where we will be hosting about 10 to 12 African nations at the White House to specifically talk about cancer care, the challenges and opportunities that exist, and how we as a community can help support that. But then there are also other countries that we have a focus on right now, including India. In August, we are going to be hosting the first U.S.-India Cancer Dialogue, bringing the two countries together. Cervical cancer will be a big part of that conversation as well. And then also looking at how we can bring countries together like the U.S., India, Australia, and Japan to really look at cervical cancer as well. So more on that soon.
Yay! And how do you select your countries, if you don't mind me asking?
No, it's a really great question. So we began in Africa because we felt that that was, you know, where the greatest need was. India as well, a lot of opportunity, but challenges at the same time. And really the way that we have engaged with countries has been very intentional, where there are you know, motivation and desires to be able to work together is really a key factor here. But we've been just really overwhelmed in general with the enthusiasm to be able to come together as one to work on these very complicated challenges.
And one of the things that I have observed, and not just, I've observed with many conferences, is a missing voice, and that is of nurses, because they are working with the people, sometimes I dare say, longer than the doctors.
Yes.
Is there any strategy for the White House to work with these middle-level health workers, as opposed to the directors?
Of course. I mean, we work from the patient level upwards, and that includes nurses as well. We understand what an incredible part of the workforce they are, particularly when it comes to supporting patients, which is one of our key goals for the Cancer Moonshot, is the support of the patients, and we recognize fully the role nurses play in that. I will just say one of the biggest accomplishments this administration has had recently is around patient navigation. So the understanding of either nurses who serve in those roles or community workers who serve in those roles. We now have over 150 million Americans a covered service for patient navigation now. So in other words, insurance will now cover that service. So really supporting that entire kind of supporting community is really a priority for us as well. So yes, 100% on board for
How can we roll this out to sub-Saharan Africa, to low and middle income countries? Because, and I say this out of passion because that's what I was focusing on for my course, is to understand the patient journey.
Yeah.
And where to intervene in that patient journey. And what I learned, one of the things I learned, is that the nurses play a critical role in the first communication with patients.
Absolutely.
And so it's critical to engage them.
Yes, absolutely. We know, based on studies that have come out now, that patient navigation improves health outcomes for cancer patients, because having somebody help you navigate this very complicated cancer care journey is so important, releases a burden off many patients, and that's why with leadership from the First Lady, we've seen a lot of movement happen here in the United States around patient navigation. And of course, we hope that countries in sub-Saharan Africa will adopt similar opportunities as well, recognizing that there are competing priorities, right? So we need to get the basic infrastructure and workforce in place and to be able to support that. And then these components really come after that.
I'm glad you mentioned workforce development because it's a huge need in sub-Saharan Africa and other. I think we've heard from people in Macedonia that it's a problem. So in terms of, I guess I'll first pivot away from that and talk about, for example, the Global Health Catalyst Summit. They've been working in partnership with you for a few years now. What is your vision for the next steps?
Yeah, of course. We want to see greater cancer care capacity. We want to be able to, the ultimate goal is to save as many lives as we can. And that is really how we work with countries is really going to be dependent on their needs and their challenges. But I think, we've seen such great strides already. I remember interviewing with you 2 years ago. And I think looking back at that to see the progress that's been made since then has been just really astounding. And I think that is really because of the incredibly passionate and dedicated people who are behind the scenes making things happen. And I think this summit is a perfect example of people coming together to really not only celebrate the progress, but to understand where the gaps are so that collaborations can come out of this. And to the point made earlier, this is not just about listening to talks, it's about actively understanding and making those connections so collaborations can occur so that next year when we come back, we can be like, do you remember when we met last year and how much progress has been done? And I kind of foresee that again. So. And
brings me to my last question. I don't want to keep you forever. I could if I had to.
I'd love to.
But, just talking about, understanding these problems, again, some of the issues that patients face in low and middle income countries, of course, in addition to a very low physician density. For example, I was reading in Uganda, it's 15 doctors per 100,000 people. And then somebody at the medical school said, well, that's less doctors than we have here just at the medical school. Wow. Just to give you an example, but there is also costs for access to the hospitals. People don't have that money. So when we are talking about, expanding these goals for the cancer moonshot, eliminate cervical cancer, what advice do you have for governments who are working with very small percentages for healthcare, say 4% of their GDP goes to healthcare or even less.
Right.
How can they really practically achieve the goals of the moonshot? And also when we're talking about increasing screening, somebody mentioned at the talk that if there's no treatment after the screening, I think that was Dr. Satish.
Yes, it was.
Then we're not doing justice to this. So
absolutely.
What advice do you have?
I think the Cancer Moonshot is a prime example of having a movement start because you have the right leadership from the top down, right? So first and foremost, governments must recognize the burden cancer will be in their own country 5, 10, 15, 20 years down the road. And we've seen the staggering numbers. It's going to be huge. And so there must be plans in place in order to build healthcare resilience and strengthening of healthcare systems and training of workforces. And I think we have seen a really great mobilization of, especially the private sector here in the United States, working with countries in Africa to be able to fill in some of those gaps. But I think it really has to start at the government level to recognize and understand what the future will be bringing and to be planning to make sure that they are prepared for that coming down, because it's going to happen to all of us around the world, and that's why we have such a focus on this right now.
Absolutely. No, this is fantastic. And again, even before I let you leave, I would say, if you end up hosting a conference, or if you think about groups of people to have a conference for, I would advocate for nurses, and
absolutely.
I'm happy to mobilize that for you.
Amazing. Thank you so much. Such an important community.
Right, and not only that, survivors,
yes.
I think they're the best ambassadors
Absolutely.
for spreading the messages.
Absolutely agree.
But with that said, thank you for everything
Thank
that you
you.
do. I follow all the work that you're doing, and we need that kind of partnership to reduce disparities.
Absolutely. Couldn't agree more. Thank you for the work that you're doing and for bringing us together here today.
Absolutely. And I forgot to ask whether there was anything we left out that you'd like to tell our viewers.
Oh my gosh, I think you pretty much covered it. But just to know that we are hard at work every day to make an impact around the world around cancer.
Well, thank you again, Dr.
Thank you
Young.
so much.